Alrighty. So my name's Gavni. I'm one of the nurse practitioners here at Joy Wellness Partners. And today we're going to be talking about the GLP-1 weight loss membership that we're super excited to be launching. Really kind of touching on tirzepatide, which is one of the GLPs, and the approach to total body health here at JWP, the way that we integrate our GLP-1s and what makes us stand out with our whole weight loss program. Because the big thing we emphasize is that this isn't just like a weight loss class or course. You don't just start the GLPs and get going. It's a whole conversation about a full metabolic reset because we really want to have the GLP-1s integrated in with lifestyle and really kind of assessing all of the other factors that could be helping with your weight loss journey to help lose weight, but then keep it as something that's sustainable long term as well. So, a big thing is, talking about why we gain weight. A lot of times when we hear things about weight, there's, focusing on diet, exercise, and discipline. So it's a lot of emphasis on willpower, but it's really not talking about the biology behind weight. We know that some real drivers can be hormones. So that can be sex hormones like progesterone, estrogen, testosterone. That can also be thyroid hormones. And those can play a very big factor in weight for both men and women that are in perimenopause or menopause. Gut signaling is another one. The gut and brain are very big communicators, and that can very much so influence weight. Stress and sleep. So, a lot of those lifestyle, habits can influence how weight is put on the body and like also how it can impact weight loss ability as well. And then inflammation and insulin resistance are going to be two huge ones as well. So one of the big things to consider is that your appetite isn't just a personality trait, it is full body chemistry. And when something's off with that chemistry, it can impact weight at a much deeper level. And so we really need to hone in on what are some of those contributing factors. GLPs do come into that play when we're thinking, once we've addressed some of those potential contributing factors. What they do is they help with restoring that signal. So they help the brain and the gut communicate as one modality. The GLPs that we most often think about are going to be the semaglutide and the tirzepatide. So the name brands would be Ozempic or Wegovy and Mounjaro. And, most of the time we think about these as weight loss medications, but people don't actually know how they work. So the four main ways that mechanisms of action that we think about are slowing down digestion. So when we have slower gastric emptying, meaning the food is moving through the GI system a little bit slower, it does help you stay full for longer. It helps limit those like hunger cues that you're getting and hunger signals to help with portion sizes. Now it's finding that balance between slowing down the gastric system a little bit, but also not causing constipation. They help by reducing cravings. That can be those evening cravings, emotional eating patterns, but also just that food noise. So I think a lot of us can, relate to having food noise in the background that's just always there, thinking about when the next meal will be or what the, next food item will be. And so it can help with that as well. Stabilizing blood sugar. So, initially these GLP-1s were introduced as diabetic medications, and what they just accidentally saw were people were also losing weight. And a big portion of that is because of the stabilization of blood sugar, which can help those, mid-afternoon crashes and energy fluctuations. But when we're able to stabilize blood sugar, it can, then help with inflammation, that insulin resistance, and even help with our hormones as well, with thyroid and sex hormones. And then restoring those fullness cues. So your body can, or your brain can start responding to those satiety signals, really kind of emphasizing, the ghrelin and leptin hormones that tell us, hey, we're hungry, or, the satiety hormones of you're full now, helping to really hone in on portion sizes and start setting those habits on portion sizes that can set you up long term as well. So, just a few ways how these GLP-1 medications can work in the body. alongside pairing it with everything else, lifestyle wise. So the two that we mainly think about are the semaglutide and the tirzepatide. The semaglutide is a GLP-1 itself. We use that as well here at JWP. I would say most often we tend to lean towards the tirzepatide just a little bit more because it is a dual, it has a dual action mechanism. And so it's working on GLP and it's a GIP agonist. And that GIP can do many of the things that the GLP does, but it also can enhance fat metabolism and insulin sensitivity. So, in studies, what we see is, a little bit additional weight loss, a little bit more sustained energy, helping bring those metabolic markers like hemoglobin A1C, the lipid panel, those back into regular ranges as well, and fewer of those side effects. So, actually, one of the things we should touch on is the GLPs are great for weight loss, but they also have a lot of benefits to metabolic markers in the body. So, you think of like hemoglobin A1C and the cholesterol panel, so they can be really good for your cardiovascular system too. Now, a lot of times these GLPs are given without any sort of guidance in terms of lifestyle. And so I really want to touch on, GLPs have a lot of benefits, but what they don't do is help build or preserve muscle mass. They don't help create sustainable lifestyle habits unless unless you have guidance in helping you do that and have those habits made that can keep those and help you keep those long term. They don't replace proper nutrition strategies. So, yes, these can help decrease portion sizes and reduce appetite and hunger, but you still have to make sure that your nutrition is on point. So, getting enough of, those micronutrients, protein, focusing in on the actual diet that you're intaking as well. And they don't help prevent weight gain on their own or the weight regain on their own. And so an important reality check is these medications are they can be very effective tools, but they're not going to be silver bullets. You really want to make sure that you have proper support throughout your entire weight loss journey. We kind of touch on some of the common risks that can happen without that support from medical providers, but we'll touch on that here. So some of the common pitfalls on why getting just the injections themselves or the shots themselves fail over time. If you're taking the medication that's suppressing, appetite, but no one's monitoring your muscle, no one's taking in regard your hormones, your gut, or those micronutrients, what are you actually losing in the long term, right? Like it's more than just about weight. We also need to consider a lot of other factors like your metabolism and your muscle mass. So, without proper guidance and support through the weight loss journey, you on the GLPs can see significant muscle loss. That can be, up to 30% of muscle loss because you're reducing your appetite and you're not, having adequate nutrients. But then also, no one's really guiding you through the lifestyle habits of, getting an exercise regimen going to help preserve that muscle mass. And long term, that can slow down your metabolism when you're decreasing your muscle mass. Nutrient deficiencies, we kind of already touched on that a little bit too. When you have lower food intake, you really want to make sure that what you're taking in is nutrient dense, and that's where you want some additional support with that. Um, Metabolic slowdown. So when calories are too low, your body can adapt to just having this new metabolic set point. And eventually it does adapt by just burning less and less. And that's where you can also get the plateau there. So really having, that additional provider support to get through that. Gut dysfunction is a big one, really watching constipation, bloating, and even acid reflux. And so getting support on how to make dietary changes and lifestyle changes to limit that from happening. And then weight regain. A lot of times, you a lot of people have goals to lose weight and we can do a lot to bring that down, but we need to make sure that we're really helping you build habit changes and nutritional changes that set you up for the long term. Yes, people can be on these injections for years and years, but there are many clients that don't want to be for years on end, and they want to be able to come off of these and help maintain that weight loss as well. So, at JWP, what we do a little bit different is we have a total health membership. It's the most supported metabolic transformation model because it's not just a, hey, here's your injection, see you in a few months, hope you're doing well. It's a full medical, nutritional, and metabolic transformation that we aim for. And what that includes are the metabolic medication. So you have a full 12 months of the GLPs, whether that's the tirzepatide or the semaglutide. And we utilize innovative strategies that we'll touch on here in the next few minutes as well. So more emphasis on microdosing. We use body composition tracking, and we'll touch on that as well. Metabolic technology, clinical oversight, which is huge, nutritional support, and supplements to help with this weight loss journey as well. So clinical oversight, we start off with advanced laboratory testing. We kind of talked about some of those hidden drivers of weight, and that's going to be looking at hormones, your thyroid panel, looking at some of the basics like CBC, CMP, looking to make sure that, taking a look at any sort of insulin resistance. So it's a pretty comprehensive look at all of the things that could be working against you in the background and taking a look at your metabolic profile at a baseline and see how those things change over the course of your 12-month journey. Regular provider follow-up, so you're going to be checking in with us. We'll make adjustments to things. And one of the big things is we really figure out where your baseline is with your lifestyle. Anyone can say, hey, start exercising more. Hey, start eating this way. But we need to figure out what your baseline is and see, based off of that, where can we make realistic changes that are going to set you up better? And continue checking in on those throughout the entire course of the 12 months or longer and making tweaks as we need to. Progress and safety monitoring. So that's where, we're checking in on the lab testing, checking in on your dosing, and including these body composition scans. These scans are incredible. I've done them myself. They're the in-body scanners. So very quick. This picture shows exactly what you can expect. You stand on the platform, and what it's doing is it's giving you a full analysis on your lean muscle mass, fat mass. So it's more than just the weight. Like the number on the scale isn't always the best gauge. Sometimes you don't see any change on the scale, but you're noticing that your clothes are fitting different. And it's because of those changes in body composition. So it gives you a better understanding of, hey, fat mass is going up. Where's muscle mass at? So it gives you that, but then the other benefit is really monitoring that muscle mass to make sure that you're preserving it and maybe even building some muscle while you're going through this weight loss journey. Because we know it goes far beyond just the number that you see on the scale itself. One other thing I wanted to touch on with the in-body scans are, the muscle mass is huge because muscle is going to be the key to longevity, and muscle also supports metabolism. So if you want to have, long-term weight management without the GLPs, you need to ensure you have enough muscle because it's going to support that metabolism. The more muscle you have, the more of a caloric intake you can also have. So that's another consideration. We do use metabolic technology, specifically the Hello Lingo continuous glucose monitor. It towards the end of your journey, this is a very powerful tool to really learn how your body is responding to foods, how your body is responding to all of the different lifestyle factors that can be influencing your glucose. It's the little continuous glucose monitor. It goes on the back of your arm and it gives you real-time data through an app on your phone. So, you really can learn how your body is responding and utilize that information to kind of set your patterns from there on. And it does give you that real-time data. I've also used this and it's really, really insightful because everyone's body will respond to specific foods and stressors was a really big one that I noticed differently. And so it gives you an individual outlook on it. And then nutritional support is something that is also included in your weight loss journey with us. It's going to include 4 sessions with our holistic nutritionist, Angie at Angie's Real Foods. She's wonderful. She meets with you at the intro and then throughout the entire journey as well to really educate you on your optimal protein goals, fiber intake. She teaches you about, carbohydrate choices, meal timings. So it's all going to be individualized. You meet with her, she again will look at your baseline and find out ways to make nutritional changes and make sure you're getting enough of those micronutrients that can work well with your lifestyle, right? Like, again, we can tell everybody, hey, make sure you're doing X, Y, and Z. But if it doesn't fit your lifestyle, it's not going to set you up for that long-term success. So, working with providers that can meet you where your lifestyle is at and make realistic adjustments is going to be a huge thing. And Angie does a great job of that. And then the other thing that's included are supplements. So we have, these are just some examples, but magnesium, creatine to help with muscle retention and metabolic support, probiotics because we really want to make sure that your gut is supported, same thing with the fiber, and electrolytes to make sure you're maintaining hydration and cellular function as well. And then one of the other things that sets us apart, oops, is we use you have access to even additional advanced peptides on top of the GLP-1s. And that's more of like cutting edge peptide therapy. So using things like AOD, MOTS-c, BPC, or CJC ipamorelin. These are just advanced options when you are needing that additional metabolic support, whether it's, hey, I want to help build a little bit more muscle during this journey, or I want to improve my healing. So, various different options, and that's where meeting with the provider is huge. You may not start with these initially. These may come into play later on. It, will be individualized and based off of how, things are going for you and your labs as well. And then it's not written here, but you also get access to the hormones. So, we're checking your hormone levels beforehand, and many of our clients integrate GLP-1 therapy with hormone replacement therapy if it's fit for them to address all of some of those factors that could be impacting weight. One of the other huge things that makes our weight loss program a little bit different is that we use expert-inspired approaches. So we're always, using like, what am I thinking of? Oops, sorry. We're always looking at cutting edge research, different approaches that we can be utilizing to give you guys the best long-term results. This idea of microdosing tirzepatide actually comes from Dr. Craig Conover. It's the concept of using a lower dose and more of a physiological dosing of peptides to give you more gentle, consistent signals rather than starting you on a higher dose, we start you a little bit lower. And that does not mean that you're not going to get the outcomes. That just means that we're wanting to help your metabolism adapt to it by giving it that gentle little push versus like, here's a larger dose. And it really suppresses your appetite, and then you're not eating, you're not getting those micronutrients. So then your metabolism is not being supported. It's just being sent into panic mode, essentially. So we start a little bit slower. We titrate slower based off of your goals and how your body specifically is responding to the GLP, because everyone will respond differently. So that dosing titration will be tailored to you, your hunger cues, your weight, how the rest of your lifestyle habits or changes are also going. Um, some clients may dose a little bit more frequently than once a week. Again, it's going to be most often it's once a week, but it is tailored specifically to you. And then what it does is it helps to also limit some of the side effects. which are down here. So you get fewer side effects when we're starting lower and titrating based off of your response. More of a stable blood sugar. We're also helping protect that muscle by doing it this way because again it's that picture of decreasing the appetite too much and not letting your metabolism get adjusted to it versus just saying, hey, here's a higher dose, let's really drop that appetite, but then your muscles are the ones that take the hit long term. And better compliance as well. So when you're having fewer side effects, your metabolism is working with you during this journey. Our patients tend to stay more committed. They have better results in the long term, so better compliance over time. So just a big, segue into why JWP stands out for their weight loss membership specifically. We do a lot of monitoring. You're going to be working with us medical providers. We're going to be, giving as much handholding as you need. We're helping support you through this journey because it's not just the injections alone. You need to be monitored. Your muscle mass needs to be monitored. And we need to take into regard what your hormones and inflammation and any sort of insulin resistance are also doing alongside this too. You do get advanced support. So, we kind of touched on that advanced protocol that we use, and any sort of like advanced protocols for other peptide therapies as well, which you do get access to, which is great. Nutritional support with our nutritionist, which is huge. And then a real bit, like truly a comprehensive look at health, which is where that, the hormones and gut health and all of that tie in through working with a medical practitioner through your whole journey because weight loss isn't just, like I said, about the number on the scale. There's so many other factors into it, and you want those long-term results. So this is just one real patient story. This is Tina. So this actually isn't even updated, but this was a before and after. We really want to help you focus on weight loss, but then we also want to help with energy, confidence, better sleep, reduced inflammation, consistency with nutrition. We want to set you up for long-term weight management. We want you to feel good and be able to get back in with, feeling good around your family, going, on like a big one that I hear is being able to move without pain and being able to, go on trips and hikes and play with your grandchildren, whoever it may be, and be able to do that long term. So, real patient stories, I think, are always, they give you like better insight into it. And so just know that through our weight loss membership, we really want to set you up for that long-term weight management. And then how do you get started? So all of our anyone that's interested in a weight loss membership would start with a consult with one of us providers. And during that consult, we really help or we really get an idea of, your past medical history, any medications you're on, what your lifestyle looks like. We go through diet, sleep, stress, everything that could be interplaying with this. Um, and we also go through what things have you tried in the past for weight loss, what's been successful, what hasn't been successful, and we start with the blood draw as well. And then you come back in and we go through all of that. It's a very comprehensive appointment where we touch on everything that is, lifestyle based as well, alongside all of your labs. And then we do have this pre-sale launch. We're introducing this weight loss membership on December 29th. So that's really exciting. It's $5.99 a month and it does include everything in that membership. So all of the supplements, the nutrition, the GLP-1 therapies, um, all of the in-body scans, the continuous glucose monitor to get all of that monitoring and labs as well. You do get a JWP Stanley Cup because you need to stay well hydrated while you're on these GLPs and priority access to appointments with us practitioners because we want to make sure that you have access to get those follow-up appointments with us. So that all starts at $5.99 a month. And yes, it does include the GLPs as well. Um, Now, this is probably like our good starting point, but additionally, if you do purchase on December 29th or 30th, you also get a free fat burner IV. And then, more excitingly, we have the New Year, New You special. So, if you purchase the weight loss membership by January 31st, you do get 50% off the first 2 months of the year, which is really exciting because we know, people, we want to really make you feel motivated and set you up for that success going into the new year. So, this is, I think, also a good time to get any questions from anybody because I know I went through a lot of information. You do meet with the providers during the pre-consult and the initial consult. We go through everything that's included. We go through all of your labs and really, help answer any questions and all of that. But if there's any questions that anybody has specifically right now, I would love to answer those. Okay, so no questions right now. If you do think of anything, you can always drop it in our chat. Feel free to text us. We'll look through our Instagram live as well, just to make sure there weren't any questions there that we didn't address, and we can always send a little update to those. Awesome. Well, thank you for hopping on with me, and hopefully we'll be seeing you in the office to chat soon.